Hello everybody, I am Mehmet Duray from Süleyman Demirel University in Turkey. I am one of the member of the project that name is Clinical Care for Electrical Stimulation in Physiotherapy and Rehabilitation. Our project was funded by Erasmus Plus program of the European Union. These are our project partners. The Pamukkale University is the project coordinator. University of Craiova, Hatay Mustafa Kemal University, Başkent University, Süleyman Demirel University, Şule State University of Applied Science, and Burdur Mehmet Akif Ersoy University are our partners. And we have some association partners, Turkish, Romanian, Lithuanian, and Estonian Association of Physiotherapists are our other partners. I will make a presentation about low voltage and medium frequency currents under Model 2, currents used for electrical stimulation. In this chapter, I work with Ziya Yıldız from Isparta University of Applied Science. I want to thank to him for his contribution. Low voltage current therapy aims to stimulate muscles, nerves, and soft tissues. And these currents were discovered while investigating whether electricity has other effects besides its thermal effects in the past. In the late of 1780s, Galvani touched the nose of a dart frog with a scalpel, and he observed muscle contraction under the scalpel, and he defined the electrical potential differences. And at the same time, Galvani concluded that electrical activity transmitted by the nerves moves toward the muscle, and this is a big discovery for these years. Use of the direct currents for muscle contraction continued to become widespread in the progress, and it was found in the 20th century. The denervated muscles could be also be stimulated with electrical currents like innervated muscles. Today, electrical stimulation is used for innervated and denervated muscles in the treatment, and its aim has several according to the disease. In some cases, we want to provide pain control. In some cases, we want to decrease muscle spasticity. In some cases, we want to protect of the joint range of motion and fracture treatment. We know that the currents below 150 volts are defined as low voltage currents. 5,000 Hz is the cutoff value for the frequency, and the use of low voltage currents in the clinic differs according to their frequencies and wave words. There are some types of low voltage currents. The main types are Faradic current, rushing current, sinusoidal current, and dynamic currents. Let's start with Faradic current. Faradic current has two forms, an ancient Faradic current form and a new Faradic current form, as you see in the figure 1a and figure 1b. At the first use, paradigm currents has an asymmetrical and biphasic waveform, as you see in Figure 1A, and it consists of a 1 millisecond sharp and sudden negative increase followed by a smooth positive curve of 4 milliseconds. But new form resembles a monophasic sawtooth and rises gradually and falls, as you've seen in the figure like this. Faraday current resembles a very short-term monophasic intermittent galvanic current with a frequency between 50 and 100 Hz and a stimulation duration of 0.01 to 1 millisecond. Faraday currents provides near normal tetanic contraction or muscle relaxation to provide better results in rehabilitation. We want to reach appropriate characteristic of a current, and if we reach the appropriate characteristics such as posturation, strength, and shape in Faraday current, we can provide an action potential in the neuron, and these action potential moves reaching to the muscle spreads to the muscle fibers and cause muscle contraction. These action potentials cause the firstly contraction in type 1 slow oxidative small size muscle fibers, and then it causes to a contraction on fast glycolytic type 2 fibers. In Faraday stimulation applications made directly on motor nerves and muscles, such as muscles, this sequence is reversed. Faraday currents is used for increasing in muscle volume and strength, glycogen content, adenosine triphosphate synthesis capacity, and metabolism, and we can use the Faraday stimulation to increase pumping action released by contractions and edema control by increasing venous and lymphatic drainage. In this case, we use a special Faraday current model T, Faradayism under pressure, and Faraday current can be used for examination and treatment in the muscle denervation process. Faraday current provides accelerating regeneration and retraining the muscle. Faraday currents cause to prevent adhesions and stretch the soft tissue. Faraday currents have impulses with duration of 0.1 to 1 millisecond and frequency of 50 and 100 Hz. The new Faraday current devices provide more channel output and produce more tolerable current form. And in these applications, intermittent currents with a pulse duration of 100 milliseconds and repeated times per minute are occurred. And with these intermittent currents, the obtained response from denervated muscles are seen, and these intermittent currents allows the innervated muscle fibers to contract rapidly and the denervated muscles to contract slowly. In Faraday stimulation, the lower pulse number and current intensity are preferred in especially small size muscles, but it shouldn't be forgotten that the number of treatment sessions should be higher. The treatment sessions are divided into 2 or 3 to tolerate muscle fatigue. Treatment sessions can be changed according to our aim and the disease. To gain in contraction, to optimal gain in contraction speed, we can use 10 and 15 sessions or 2 or 3 weeks. To increase muscle strength, we can use 20 and 25 sessions or 4 and 5 weeks. If we want to increase muscle endurance, we can increase the session number to 35 session, or we can use fatigue stimulation for 7 weeks. The second low voltage current is Russian current. Russian currents were first called interventional currents in the 1950s. In 1977, Coates discovered that Russian current increased the muscle strength of elite athletes to 40%, and again Coates discovered that Russian currents provides deeper penetration and higher tolerance than low frequency currents. The Russian currents have 2,500 hertz frequency, and it is a medium frequency. The current consists of successive bars with polyphasic wave forms, as you see in figure 2, polyphasic, not mono or biphasic form. Each period of current consists 50 periods per second and consists of bursts of 10 millisecond and 10 millisecond rest interval, as you see in figure 1, 10 millisecond burst and 10 millisecond rest interval. The Russian currents have 50 to 400 milliseconds pulse duration, 1000 to 2500 hertz frequency, and 5 to 15 seconds beat cycle. These are the frequently preferred parameters of Russian currents. The motor units contract non-selectively with Russian currents, especially the largest motor units contract first, and because of these, more muscle fibers are activated than during voluntary contractions during Russian current stimulation. Non-selective and asynchronous activation of muscle fibers decrease the muscle strength. So the combination of the Russian current with exercise is preferred to provide effective contraction, coordination, and train fast twitch and quickly fatigued motor units. Russian currents is used especially for increasing muscle strength, especially in athletes and healthy persons, but it can be used in other disease groups such as neurological patient or ligament surgery. Muscle strength increases by approximately 30 and 40% in athletes. We can provide positive effects on the motor ability. We are increasing the hip muscles of elderly neurological patients with using rushing current. Rushing current strengthens the quadriceps muscle group after the ligament surgery, anterior cruciate ligament reconstruction, and as well as neurological and orthopedical disease group in respiratory disease group. The Russian current increase the extremity muscle strength. Rushing currents penetrate more deeply than low frequency currents because the lower skin impedance and the contraction is obtained physiologically as close to normal contraction as possible in Russian currents. So, because of the penetration more deeply and the contraction physiologically as close to normal contraction, the patient discomfort and fatigue are very low and the current tolerance level is high. Suggested frequency for optimal effect is 2.5 kilohertz with direct muscle stimulation and 1 kilohertz in applications on the nerve trunk. And if we reach the maximum muscle torque generation, the suggested parameters are a burst time of 2 milliseconds and frequency of 1 to 2.5 kilohertz. In the application, the current intensity should be increased considering the patient's tolerance. If the force production is to be increased, stimulation must have a tiring effect. In the application, a special technique named as Russian technique is used. This technique defines 10-second on period, and after a 10-second on period, a 50-second off period, and this technique is continued for 10 minutes. In Russian current application, electrode size 5 and 5 for each age. In applications, we don't use smaller electrodes because to not increase current intensity because of the causing pain, and we don't use large electrodes because to not activate the antagonist muscle and decrease the desired force. The third low voltage current is sinusoidal current. Sinusoidal currents have symmetrical sine wave with 50 Hz, as you see in figure 3, and contain the currents contain 100 pulses per second of 10 milliseconds each, and the currents are used to provide muscle contractions and usually applied over large areas for sensory stimulation. The sinusoidal currents produce a pricking sensation on the skin. If we increase current intensity, from this level, we can stimulate the motor nerves. After the motor nerve stimulation, erythema may occur by increasing the blood flow. And in the sinusoidal current application, activation of potassium channels is occurred rather than inactivation of sodium channels by high frequency biphasic currents. And these explain the analgesic effect of sinusoidal currents with the nerve conduction block and exerts uh, and analgesic effect is occurred. Sinusoidal current is used for pain management, sensory evaluation, wound feelings, stimulation of both denervated and innervated muscles. In the applications, because high current intensity is needed, it is difficult to tolerate for the patient. In the application, the patient should be seated in a chair for upper extremity. If we have a patient with a lower extremity problem, the patient should be placed in the swing or side position. The current is increased until feeling a slight pulling and tiring sensation. If a motor stimulation is desired, muscle contraction should be seen by physiotherapists. And to reduce discomfort, moisturizing creams or a saline solution should be applied to the application area. The last currents are diadynamic currents. These currents developed by a dentist in France in the early of 1950s. His name is Pierre Bernard. Diadynamic currents have a broad analgesic effect on soft tissue injuries and systemic disorders. The current consists of both galvanic and Faradic currents. It is a combined current, and there are 5 different types of diadynamic currents: monophase fixed, phase fixed, short period, long period, and rhythm syncope. Monophase fixed is a unidirectional current with a frequency of 50 Hz, and the current has a sinusoidal waveform, fluctuates in 10 millisecond intervals. The analgesic effect of the current is low but long-lasting. It provides a very strong vibration and a deep sense of pressure. Monophase fixed is used in painful conditions due to spasm and when the stimulation of sympathetic ganglia is desired. The second type of diadynamic currents is the phase fixed. This is a bidirectional current with a frequency of 50 Hz, and it has an analgesic effect, reduces the sympathetic tone. The fast fixed is administered at intervals of 10 to 15 seconds for pain modulation. Due to the rapid adaptation of the tissues during the phase fix, the optimal administration time is 1 or 2 minutes. The phase fix is a starting current, so it is used before the administration of other types of the diadynamic currents. The third one is court period. Court period is created by the rhythmic alternation of a 1 second. It has single and double pulse current at regular intervals. Court period has vasodilation, hyperemia, and analgesic effects. The application time of court period for one area 3 to 5 minutes, and this current can be applied twice in a day in acute situations, but in other situations or chronic situations, it can be applied once a day. Long period, in a long period application, the current is changed to the phase fixed after 10 seconds of the monophase fixed current. Long period is achieved by a second half wave with gradually increasing amplitude and lasting 6 seconds. Long period has special inhibitory and analgesic effects and has a stimulating effect on smooth muscles at appropriate intensity. And long period is effective on in the case of neurology, myalgia, lumbago, functional disorders of locomotor system in general, and gastric and intestinal hypotonia. The last type of diadynamic currents is rhythm syncope. Rhythm syncope is has a modulation of monophase fixed and has a 1 second transition and 1 second rest time. The current has equal pulse and rest periods within 1 second transition time. Rhythm syncope is a unidirectional current. It has 0.5 Hz, and the contractile effect of rhythm syncope can be irritating for the patient. So the tolerance is low. Care should be taken when using monophase fixed for muscle strengthening. This is very important. Diadynamic currents have analgesic effect on tissue. The theories explaining these analgesic effects are a gate control therapy and opiate system activation. Opiate system activation causes the release endorphins, and this is the main explaining of the analgesic effect. Pain inhibition and current tolerance can be achieved by keeping the pulse and resting time of the current short. So continuation of the dynamogenic effect is ensured. Diadynamic currents can be used in chronic traumas, sprains, degenerative joint disease, circulatory disorders, and pain management. After diadynamic currents obtained increased blood flow, locally relaxes the muscle, reduces edema and pain. So diadynamic currents is used for these problems. And diadynamic currents currents are used for the management of temporomandibular joint pain, dysmenorrhea, vertebral column pain, osteoarthritis, luxation, stylocatrophia, myalgic torticollis, muscle atrophy, and neuralgia. It has been reported that diadynamic currents is more effective than the direct current, MANS, and TANS for reducing pain, especially when used as a single agent. It is necessary to take into account the degenerative effect on the skin with the effect of the galvanic current. The safe application time is explained as 6 minutes. If an application is made longer than 6 minutes, the current should be stopped and the electrode should be changed. If we have more application time, longer application time than 20 minutes, protective solution should be preferred in the application. Period is used before long period for analgesic effect. It shouldn't be forgotten, and currents are usually used in order as the device peaks, short period, and long period. Device fixed and long period with a modulated the galvanic component of 66% reach deeper. The preferred parameter should be applied for 3 to 5 minutes depending on the severity of the disease. If the application will be made on a large area or deeper structures, the application period should be extended. The current diadynamic currents should be applied five times in a week in acute cases, and for chronic cases, it should be applied once a week. Before using diadynamic currents, a galvanic current of 1 to 3 milliampere is given to the tissue, and the diadynamic current intensity is then increased up to the tolerance level. The tolerance level is usually between 3 and 12 milliamperes, and the phase fixed and long period times, it is necessary to slightly exceed the threshold level a little. You can use the fast fixed for 10 and 20 minutes to increase sympathetic activity. If you treat a regional muscle spasm, you should place the anode electrode on the trigger point and you should place the cathode electrode on the origin of the muscle. For painful spasm of the muscle, both electrodes are placed to the muscle body using the short period and long period combination. For low voltage currents, no risk have been reported, but physiotherapists should be skeptical of practice in the case of such as high fever, hypertension, anemia, severe kidney and heart failure, history of cobalt therapy, and mental disability. There are some contractions of the diadynamic currents that are some electrolytic reactions on the skin, the presence of pacemaker and implanted electronic devices, to be in the first trimester of a pregnancy, during hemorrhagic conditions. The diadynamic currents don't be used on open wounds, carotid sinus, and over-eye applications. In uncontrolled epilepsy, the current is not used, and during electrotherapy, please don't use the diadynamic currents. You can find lots of information in our references, or you can read our book chapter. These are our project partners. I want to thank to all of them, and I want to thank to you for listening. Thank you.